Welcome back, everyone, to our last session of the day, Navigating the System of Care, practical advice for your journey. Remember, we will have time at the end of this session for questions, so please feel free to pop those questions into the chat box on the right-hand side of your screen. Please join me in welcoming our speakers. Arrow Big Smoke is an Indigenous cancer patient navigator and works for Cancer Care Alberta out of Calgary. Next, I would like to welcome Bailey Creech. Bailey is a nurse navigator at the Lloydminster Community Cancer Centre. And last, but certainly not least, I would like to introduce Britney Chodkiewicz, who is the Adolescent and Young Adult Nurse Navigator at the Cross Cancer Institute in Edmonton, Alberta. In this session, Arrow, Bailey, and Britney discuss how to get what you need from a complicated healthcare system, regardless of your cancer center has nurse navigators or not. So Arrow, I'm now going to pass it over to you.
Thanks, Stephanie. I'm just going to start by sharing my slides here. Okay, so thanks again, Stephanie, for introducing me. My given name is Arrow Big Smoke. My traditional name is Akwi Nimaki, meaning Pipe Woman in Blackfoot. I'm a proud member of the Blackfoot Confederacy and registered with the Piikani Nation. I currently work as an Indigenous cancer patient navigator for Cancer Care South in Calgary. And I'd also like to mention that the program is funded by the Alberta Cancer Foundation and it runs through Alberta Health Services. Sorry, I'm just trying to get to the next slide here. I'd like to start off with what is a navigator. So a navigator is someone that helps the clients get from point A to point B without that animatronic voice playing in the background. We like to give resources and phone numbers to clients that may help them along their pathway to help guide them. And something that was interesting was one of the surveys that was just recently done here in Alberta shows that patient satisfaction was increased when they had the assistance of a navigator. So navigators are viewed as connectors. So we connect with each other, we connect with other social workers, we connect with nurses, we connect with physicians, community, pharmacy, and we all work together to help build this layer of support to better support the clients. And so Britney and myself are involved in monthly rounds, and the purpose of rounds is to locate resources and advocating against barriers that clients encounter along their cancer journey. And what's interesting is that as a part of the rounds, that most of the providers that are involved, they are actually turning into allies within their own sectors and their own departments. And so for example, the radiation oncology clients will be able to come in, they'll see that friendly face and be able to have that relational connection. So one of the things that I've heard about navigators is that we actually will view not just from the physical sphere in which our health system generally resides in. And so I like to refer to the medicine wheel for this. Navigators generally will see the whole person and therefore will make referrals and suggestions to other services within the system to be able to, again, formulate that really round, secure supportive care. And a couple of the things that we've been working on within cancer care to help again increase that support network is we're working towards improving experience for clients that are going through therapies such as brachytherapy and hoping to improve that experience. We're also looking to put together a traditional medicine working group with the eventual prospect of being able to assist physicians in supporting clients who choose to use traditional wellness in a part of their care. So as an Indigenous cancer patient navigator, I only work with clients and families who identify as Indigenous and who are impacted by cancer. I am a registered nurse by trade, and the members that I was speaking to include those that are Métis and Inuit, as well as those that are status and non-status. There's 3 of us in Alberta. One is in Grand Prairie, one is in Edmonton, and then there's myself who is in Southern Alberta. The referral process is fairly easy, and I hope for it to be fairly accessible. And so you can refer to me by just giving me a call and connecting, or you can also get either a family member, community member, or another provider to send an email. Either way, hoping it to be fairly barrier-free. So why do we have Indigenous Nurse Navigators? So as we all are aware of the recent findings and of the children that attended residential school, those historical and intergenerational traumas can really filter down and leave the client feeling unsafe and untrusting of the healthcare system. And so I will often find myself liaising with the client and relaying that information to the healthcare providers, because sometimes there's clients that would rather, that feel more comfortable talking to me and relaying those issues than talking to the healthcare providers themselves. I will also attend appointments as well, where clients have vocalized feeling unsafe, judged, or not heard, and advocating for the client's wishes and rights within that appointment. So ways that a navigator can be helpful. So we spoke to advocating, and that's a huge part of the role in which we do. We will also ask for family members to be a part of the care conversations with the medical team. And actually, and this is especially during COVID, clients will come with their support person. And at one time, we actually had the whole family being brought together on the other end of the phone so that they could be a part of that conversation with that client. Another area that I commonly help with is scheduling. So if the client is up against barriers where they're living either away, or their transportation isn't as reliable, or they just have other things going on in their lives, maybe small children. That's one area of advocacy where I will ask the provider to either reschedule or move their appointment up. As previously discussed, traditional wellness and ceremony are things that are important for some clients to be brought into their care, and it's also something that we will ask for. Connecting with community health centers is another thing that we do. So again, referring back to that connection circle or that connection diagram, and reaching out to healthcare providers, physicians, nurses that are working within those health centers on nations. Another thing that I'll do is assist with accommodation, transportation, etc. And then again, just attending appointments if there's no support available for that particular client. So for some clients, not all, and a matter of fact, most clients are able to navigate the system on their own and do it very well and efficiently. They're able to make really meaningful, purposeful relationships with their providers, and they're able to advocate for their own needs. But for some clients, what the gaps in care can actually feel more like canyons. And so for some of those barriers, an example of them would be some clients that don't have status. And so again, the financial barriers that really come into play. Clients that are living within the city don't necessarily have access to the NIHB transportation. And clients, again, that are living rurally that may have poor cell phone service can also act as a barrier as well. And these are things that I will let the team know of, and they're things that we need to work with the client in order to bridge some of those gaps. So life is challenging enough without a cancer diagnosis. So in addition to the physical obstacles, emotional obstacles are just as challenging. I've often heard clients vocalize that they are feeling alone, that they feel isolated, and that they feel like a burden to others. I've also heard clients say that having discussions around cancer can be really challenging with family, loved ones, and younger children. And so this is where navigators, again, take that very broad lens when we're working with our clients, and we reach out to different services. And so I actually work within psychosocial oncology. So I work alongside very closely with psychologists, social workers, and psychiatrists, in addition to working very closely again with palliative care, because I find that when they're brought in, again, forming that really a secure net for these clients, and then being also able to help get their symptoms under control is extremely important. And again, having their voice heard and recognized. So helpful tips if you don't have a navigator. So coming from an Indigenous lens, if you are in a facility that has an Indigenous liaison or an Indigenous worker, I would suggest connecting to those clients. I would also encourage you to bring your supports with you. And I would also encourage to look for apps. So at the bottom of the screen here, that blue box is My Conversations app. So I've also heard from clients that at times the appointments can be really overwhelming. Their jar is full with the amount of information that they're taking in. And so being able to record the conversation with your provider, take it home, and then being able to listen to it at a time and point when you're maybe a little bit more able to be open to that conversation is also really helpful, in addition to helping you with those conversations with your family as well. So in addition to that, I would also suggest keeping communication open and finding someone that you trust within your healthcare provider. So either whether that's a nurse, a social worker, a physician, somebody that can help advocate for your needs. And then I also would say make a list of important phone numbers. So some important phone numbers that I give out to clients when I first meet with them is the telephone triage line for symptom management. I also give out the NIHB number to help make your own transportation. And then I also give out the distress number, the distress line. It is, for those that don't know, it's a 24-hour, 7 days a week service that we have available to clients within Alberta, because as we know, mental health doesn't stop at 4 o'clock. So we can have those times when we just need to vocalize or need to vocalize our emotions. And that's exactly what this is. It's a non-emergency service where clients can call in and just vent their frustrations. And most importantly, the tip that I would suggest is be your own advocate. Don't be afraid to ask for what you need. Don't be afraid to bring family, friends, support in, and don't be ashamed to ask for words to be repeated or explained. So oftentimes when I've attended appointments with clients, words like metastases, reoccurrence, lesions, aggressive cycles, these are all words that sometimes clients will go along with, and don't really necessarily understand what the meaning behind that is. So again, not being afraid to ask those questions. And I would also say, don't be afraid, don't feel like a burden. It's our job to help. We're healthcare providers. We got into this position because most of the time, like we love helping people. So those are the 3 don'ts, I would say. And then for the do's, I would tell somebody if you feel like your care is not appropriate. And so in most provinces, you're able to Google patient concerns line, and there's a number that pops up where you're able to vocalize what's going on. And so lastly, I give out handouts to clients. And so those handouts generally will include my brochure, again, with those numbers that I had spoken to. And then also I will give out a brochure for the Indigenous Cancer Sharing Circle. So this is an initiative that we started here in Alberta for clients that identify as Indigenous, that want to come together, that want to be able to identify with people going through similar situations. And with that being said, my contact information is here in the corner. And thank you for listening to me, and I will hand it off to Bailey.
Perfect. Thank you for that, Ariel. So my name is Bailey Creech. I'm the nurse navigator based out of Lloydminster, which is Alberta and Saskatchewan. We function on the Saskatchewan side, but we deal with patients on both sides of the province. So I'm actually funded through Alberta to do my role, but deal with patients from both sides of the province. So I'm just going to start sharing my screen here with you as well. And I wanted to touch base on some things that are a little bit more specific to my patient population that I deal with, which is more of the rural population who's dealing with more transportation and those kinds of things to bigger centers. So just starting here, navigating a cancer journey. It's common for most of our cancer patients to feel very overwhelmed and confused when getting into kind of navigating this whole system. Most people, this is their first time experiencing the healthcare system in a large portion of their life. So you maybe had appointments in the past or checkups here and there, but you've never necessarily had to navigate on a big level and day to day and so many appointments and meetings with different people of different teams and everything. So it can often be really, really overwhelming for people and their families. And so there's so many supports out there and solutions and resources that exist to help. But often there's a lot of barriers to this as well. So we kind of work to bring down those barriers. The role of the nurse navigator is to alleviate some of the stress and assist patients in any way possible. Most nurse navigators work out of their local clinic, meaning they're easily accessible for patients. So myself, I work out of the Lloydminster clinic. There's one at every tertiary center and secondary and primary center as well in Alberta. So all that means is our little, big, and main centers all should have a navigator. Unfortunately, other provinces either don't have the same presence at all, or they're limited to kind of the bigger centers and things like that. So for many patients, that the navigator program's not there for them. But the biggest thing is that we work to be the advocate that maybe you are struggling to be for yourself. So I'm hoping to kind of touch base on some things that can help you advocate for yourself. So overview of the rural, there are many challenges that everybody faces, but I'm going to speak specifically to ones that more patients in rural areas face. There's so many things that geography just plays a part in. So that's travel time, availability of doctors, nurse practitioners, nurses, staffing availability at rural sites, financial pressures not typically associated with healthcare. So that's, hotels and food when you're staying in a bigger center. A lot of our patients travel to either Saskatoon or to Edmonton. So when you're having these appointments and you have to drive 3 hours and then stay at a hotel and then pay for meals and then take time off work, there's just a lot of pressure that way financially. There's limited resources at our smaller sites. So we can give chemotherapy treatments, but we can't give radiation, and we don't provide oncological surgeries. So there's just a lot of travel and appointments between different teams and different cities and things that it becomes very tricky for people to navigate on their own sometimes. And then the conjunctive procedures. So like I mentioned, radiation and surgery, clinical trials, there's certain drugs that we're not able to give at our sites just because of the resources we do have. So it can just be really, really confusing for people to know where they're going, when they're going, and who they're going to be seeing. So kind of from my perspective, what we do as a navigator, initially when I speak to patients, it's after they've typically had their first appointment in the larger center. So for example, Edmonton, they will have gone, they've met with their oncologist, kind of been given their course of treatment, given their different options for treatment. And quite often they've already had their first treatment when we get referral that they'll be coming to our site. So that's usually the point that I try to make a phone call to them, or if I know I'm going to be working the day that they're coming to clinic, then I'll set aside some time to meet with them in clinic. And for some people, it's just introducing myself, letting them know I'm there, kind of giving them my brochure and a list of things that I can help them with. And that might be as much as it goes. And then for other patients, they already have quite a few questions and different things they've been trying to figure out. So I can kind of jump in to help right from the get-go. And then throughout treatment, I like to say just at any point after we meet, I'm happy to help with anything. So if you're actively going through treatment or you're away from our clinic because you're experiencing radiation or surgery, but coming back at some point, give me a call. I'm happy to be that person that kind of helps you with any problems you might have. And I like to say if it's happening in your life right now, it's important to your cancer journey. So most people have a million other things going on in their life on top of their diagnosis and their treatments and all the things that go along with their cancer journey. So that's all important to the picture, and that's important to your overall health and well-being. So anything that is concerning or stressful, I'm happy to give a hand with, whether it's financial stress due to your inability to work or work at the same level. Some people, have to go down to half time and things, even if they are still working. Relationship stress, there's a lot of extra burden just on relationships with going through the whole system that I'm happy to help with those kinds of things. Time constraints, managing your family and that stuff, physical and mental well-being, as well as just changes to the roles within your household. Many people, you're used to doing everything yourself, and all of a sudden that's not really an option. So I like to just say that if you need help, call us, even if it seems like maybe something we're not going to be a part of. I've helped patients find lodging for their dogs while they go out of town for treatment or things like that, if it matters to you, it matters to us. And we just want to help in any way that we can. And then post-treatment. So Whether that means that you, like I said before, you've gone on to a different site for different procedures, or you're in remission, or you've transferred to palliative care, we're still a resource for you, and we're still somebody that can, work in your network. We're happy to get you more supports and different people that are maybe more catered to the part of your journey you're in now, but we're still that link that can get you in touch with people and be that number that you call if you ever need anything. It's often these transition stages that patients have more concerns and questions, because so many things are up in the air and you're waiting to hear back on the new team or things like that, that it can get even more challenging, or you feel like you're falling between the cracks a little bit. So I find that lots of people appreciate having that extra person that's kind of able to help them with their scheduling, help them with, calling a different site to make sure that they haven't been forgotten about, or that things are still in process of moving along. So the role is there to assist you throughout the whole time. It's not just at one point in your journey. And then I just kind of wanted to touch base, because like I said at the beginning, there's so many places that unfortunately don't have this Navigator program. And even places that are supposed to have it, we're short-staffed and things like that. So, there's barriers still even with the program. So there's lots of great people out there. It's just knowing who to contact about what things. So I just touched on a few examples, and there's so many more, but a lot of people, when they think about palliative care nurses, they think about end of life care, which they are wonderful at, but a big part of their role, especially like I see it in our hospital all the time, is pain management. And so they work with lots of our patients that are in early stages of their treatment, but just aren't managing pain well. And they have wonderful resources that can work with you, and the nurses there are really great. So that's kind of a person to reach out to. Your clinic nurses that work with you when you're getting your treatments, they may not have all the answers, but they're happy to get you in touch with who they need to, and reach out on your behalf, as well as the triage nurses. So in Alberta, there's the triage line that you can call, and they're really good with symptom and pain management, as well as getting you in touch with anybody else. Your primary oncologist, obviously that's someone that you, depending on where you live, may have a lot to do with, may only see, every few months, but they're obviously a great resource for overall questions and concerns, as well as your family physician. I know for many of our patients, they don't see their primary oncologist very often, just because they're in the cities. So they may actually see their family physician quite a bit more frequently. So, they're just a great person to have on your team and kept up to date and in the loop of what's going on, and kind of reach out on your behalf. As well as social work. I know some people don't really understand the role of social work and how they can help in different areas, but they are really a well-rounded support, and they can do so many different things, whether it's financial aid or helping get in touch with mental health resources. They can, find funding for different things. Our social workers in the area are really wonderful with different programs that they know about specifically, that can help with financial aid for travel or for treatments and different things like that. And they're just a wealth of knowledge, as well as home care. Some people kind of forget about home care nurses, just if you're not necessarily requiring them, but they're great for any sort of help with, doing dressing changes and things like that on your PICC line, so that you don't have to come to the hospital all the time. And our home care nurses will go right into your house for many number of things, and can just really keep you from having to make those extra trips to the hospital. As well as support groups. That's something that our patients talk a ton about, and especially through COVID times, it became really hard for people to feel that connect with other patients and other people going through the same journey. So just finding that online support has been huge for people. And I know a few of our programs are back up and running locally, so you can get back in touch with people in person, which is a huge thing. And then the last two I talk about are just transportation programs. I kind of touched on that earlier, that we have a lot locally funded that help just transfer to and from appointments and things like that, that you can get in touch with. And then Meals on Wheels is one of the programs we have. I know it's Canada-wide, but there's probably other ones in other centers, and they just help with preparation of meals and dropping things off, which for many of our patients is a huge thing, whether it be nausea that you're having trouble cooking yourself, or whether it just be your energy levels and you don't have the ability to maybe even leave the house to go get groceries and things. It can be a huge support for people. So yeah, like I said, this is obviously not a full list of everybody that's out there, but just kind of a few examples that came to mind of people I get in contact with quite often. So as a navigator, I don't have all the answers. I don't know all of these things. I just kind of work to connect with the web that looks after you and kind of helps with anything you might need. So those people are all still out there. If you don't have a navigator, it just becomes a little bit more difficult that you have to kind of take on getting in touch with them yourself. But it's just important to advocate and have trusted family and friends that can help you get support from any of these different resources, and just kind of have somebody in your corner that you trust that'll help you get through all of this. So the last thing I put on is just a few online resources. We have quite a few pamphlets and different things that we give out as well. And obviously that's difficult to do across Canada. So I just put a few resources that I often will send people to. And there's some really good information on the Alberta Health Services one, and it breaks it down into help for patients and for families. So I really enjoy that website. And yeah, that's all I have. So I'm gonna hop off here and leave it to Britney.
Thanks so much. Hi, everyone. I'm just going to share my screen here. Open my PowerPoint. All right. All right. So I'm just going to get this started. Can you see my screen? Okay. All right. All right. Just get this open here. So thank you so much, Arrow and Bailey. So hello again, everybody. I'm Britney. I'm a registered nurse and the Adolescent and Young Adult, or AYA Nurse Navigator for the Edmonton area in Northern Alberta. So I work with Cancer Care Alberta and Alberta Health Services, and I'm actually based at the Cross Cancer Institute here in Edmonton. So thanks again so much for having myself, Arrow and Bailey as part of your conference today. And today I'm going to be talking to you about Adolescent and Young Adult, or AYA Oncology care. So according to the Canadian Partnership Against Cancer, between 1992 and 2013, there was an increase in the age standardized incident rate of cancer for the adolescent and young adult population. So in ages 15 to 29 years, there was an increase of 18.2%. In ages 30 to 39 years, there was an increase of 11.9%. And in ages 40 plus years, there was a decrease of 2.2%. So you're probably wondering, well, who are adolescent and young adult cancer patients? So in Alberta, adolescent and young adult cancer patients range from 15 to 39 years old. And AYA nurse navigators such as myself, we care and support AYA patients between the ages of 17 to 39 years old. And that's because patients younger than 17 are cared for by their pediatric oncology teams. So I'm going to be breaking down this image in the next few slides, but I just wanted to take a moment to highlight that in addition to the cancer diagnosis itself, challenges of adolescence and young adulthood can add to the distress and anxiety an AYA patient experiences. So in the first part of this image, it demonstrates the challenges in facing cancer for AYAs during a stage of life where these individuals are developing their identities, their independence, their relationships, their education, as well as their careers. And some unique challenges faced by adolescents and young adults include disconnection from their peers and social life, a loss of independence, impact of their treatment on their fertility, interrupted education, interrupted career launch, impact on their romantic relationships, and even financial concerns. And the last part of the image shows that cancer in the formative years will affect the remainder of an AYA's life even after their treatment is completed. So the mission of the AYA program that I am part of in Alberta is to enrich care and empower adolescents and young adults and their supports to live well with and beyond cancer in Alberta. So you're probably wondering, well, what are the benefits of having adolescent and young adult nurse navigator support? So in Alberta, AYA Nurse Navigators were funded by the Alberta Cancer Foundation donors, and we are specially trained registered nurses who work with a multidisciplinary team of healthcare professionals to empower young adults to live well with and beyond cancer by providing early and ongoing AYA-specific assessment, education, and support. We do link patients and their supporters to hospital and community resources. We provide ongoing follow-up throughout the cancer experience and into survivorship. We also do collaborate with multidisciplinary team members, including adolescent and young adult oncologists, to enhance the AYA cancer experience. So in Northern Alberta, the adolescent and young adult oncologist is Dr. Sarah McKillop, and in Southern Alberta, it is Dr. Jen Willem-Henning. And as AYA Nurse Navigators, we do act as a key contact for AYA questions and concerns, and we also do connect our adolescent and young adult patients to other young adults living with cancer and available community AYA supports. So you're probably wondering, well, where are there adolescent and young adult programs in Canada? So here's the contact information for the AYA programs in Alberta. So again, my name is Britney. I'm the AYA Nurse Navigator for Northern Alberta and the Edmonton area. So here's our phone number and email at the top. And again, the adolescent and young adult oncologist for our program in Northern Alberta is Dr. Sarah McKillop. And again, I'm the AYA Nurse Navigator. And there's also an adolescent and young adult program in Southern Alberta, the Calgary area. So this is their phone number. This is their email address. So the adolescent and young adult oncologist in Southern Alberta is Dr. Jen Willem-Henning, and the AYA Nurse Navigator for this program is Jessica Scheidel. She is away, so they have April Boychuk helping them out. And just to let you know, for the AYA programs in Alberta, we take self-referrals from patients or even referrals from patients' healthcare team members. And in other parts of the country, they do have an AYA oncology program in Toronto at the Princess Margaret Cancer Centre. There's also one in Manitoba at the Cancer Care Manitoba AYA program. And then also there is one in Montreal, Quebec at the Jewish General Hospital. And if you're wondering, oh, I don't know if I can write all this down, that is okay. We actually have this PowerPoint posted on the conference website, so not to worry. You can view it and download it from our conference website, all the information. So if you're wondering, well, what if I don't have an adolescent and young adult program near me? Well, I put together an adolescent and young adult needs checklist for you. So if you need help transitioning back to school or work, please talk to your local cancer clinic, occupational therapist, or even the social worker. You need help with medication coverage or help paying for cancer medicines, please talk to your local cancer clinic's drug access coordinator or social worker. And if you need financial help or transportation to and from appointments or even accommodation resources, you can talk to your local cancer clinic social worker. If you have any fertility questions or concerns, please let your primary oncologist know and ask about a referral to your local fertility clinic to see a fertility specialist. If you experience any sexual health changes or challenges, please speak to your primary oncologist and also ask about a referral to your local sexual health clinic. Also, young adults can have a genetic predisposition, so please have a discussion with your primary oncologist about a genetics referral. If you're finding you would like some resources to discuss a cancer diagnosis with children, please do talk to your primary oncologist and oncology nursing team about resources that are available to you. If you are having nutrition or diet concerns, please ask your healthcare team for a referral to see a dietitian. And if you need assistance with physical activity or you need some equipment in your home, like a cane or a walker, please speak to your healthcare team about a referral to a physiotherapist or even an occupational therapist. For palliative or end-of-life care needs, all adolescents and young adults with advanced cancer should receive palliative care services, which may include a referral to a palliative care provider. Please discuss this with your primary oncologist and healthcare team. And then also, there's a resource named Queering Cancer, which provides online cancer support and resources for people who are lesbian, gay, bisexual, transgender, queer, or two-spirited, as well as their loved ones. And they also have low-cost online courses and resources for healthcare professionals as well. And as Arrow highlighted before, there are Indigenous cancer patient navigators that are registered nurses who do work with Indigenous peoples and their families impacted by cancer. So please do speak to a member of your healthcare team to see if they can connect you with a local Indigenous cancer patient navigator. If you do need help coping with your cancer diagnosis or treatment, please talk to your counseling team at your local cancer clinic about survivorship. So when adolescent and young adult patients transition out of active cancer treatment, their primary oncologist and their oncology team, or even their family doctor, can provide support at this time of transition. Or if you're feeling, well, no one really understands what I've been through, there are young adult cancer peer support programs and opportunities that can help. So one of them is Young Adult Cancer Canada, or YACC, that I let my young adult patients know about. So YACC is a national organization with a mission to support young adults as they move through and beyond cancer, to be the connection to peers and bridge out of isolation and be a source of inspiration. Young adults can get connected to a YACC team member and hear more about how YACC can support them by emailing connect@youngadultcancer.ca. YACC also has active social media platforms through Facebook, Instagram, Twitter, and their blogs. So check out www.youngadultcancer.ca for more information. And then another great resource I let my young adults know about is the National Comprehensive Cancer Network Guidelines from 2019 for adolescents and young adults with cancer. So the information in this book can help you understand more about what your doctors or nurse practitioners have talked to you about and other things that young adults often ask when they're going through cancer treatment. So in this book, pages 53 to 60 highlight really good questions and areas of common concerns, with actually notes pages that can be printed off and taken to medical appointments to discuss with your nurse practitioner or doctor. So the link to view this resource or to even print it off is available on the conference website. All right, so at this time, I just wanted to see if there were any questions for myself, Arrow, or Bailey.
Thanks so much, Brittany. We do have a few questions. The first question that I have is, how hard would it be to transfer my case from a different country? And who could I contact to get some guidance on this? Anyone want to take a stab at that?
I can take a stab just based on a patient I helped deal with it. She had just moved to Alberta. And so the way we kind of went about it, I don't know if it's the simplest way, but she had found a family doctor in our area. I got that family doctor to send her information to the Cross Cancer in Edmonton. And then from there, they were able to get in touch with her oncologist in the US. And then they were able to kind of send everything they needed back and forth. But we just kind of started with, okay, the family physician knows. So whether this person could reach out to their family physician or if they're already seeking treatment somewhere, I'm not sure if they've already moved or not, but that was kind of the best way we found.
I would also recommend as well getting a copy of all your records that you have from the country that you're currently in, so that you have a baseline for your oncologist to start with when you come to this country.
Great, thank you guys. Another question, where can I get in contact with a navigator?
I can start if you like. So one of the things for an Indigenous perspective is that they do have the Aboriginal navigators in Ontario, and so that you are able to, and I can provide that link as well, and it's also within my slides. But I find that if you Google Navigator, depending on what province you're in, that's generally a good way to start. Or again, just connecting with somebody on your healthcare team, a nurse, because we're pretty, there's a few of us around the country.
Yeah, our
Thanks.
teams usually go through the clinic as well. So if you're already getting treatment somewhere, just ask the clinic nurse that's looking after you that day, or your oncologist, whoever you're seeing next, ask them about it, and they'll be able to let you know if you've got one in your area.
And also too, as I've highlighted, there's not AYA programs throughout the entire country, unfortunately. So there is in Alberta, there's in Manitoba, Toronto, and Montreal do have AYA programs. So again, the PowerPoint will be posted on the conference website if you're looking to get in touch with an adolescent and young adult oncology program. And then, just like the needs checklist said, if you're having areas of common concern, feel free to view the PowerPoint again, or and then just look to see where you have an area of common concern and talk to the relevant healthcare professional about that.
Thanks, Brittany. This question is a little bit more specific for Ontario, but we'll throw it out there and see. How easy is it to get a nurse navigator in Toronto? Do you know if Princess Margaret Cancer Centre has them? Like I said, I'm not sure if you will know the answer, and if not, we can certainly try to find that.
I know Ontario does have some. I'm not sure of exactly what areas.
Thank you. I have one more comment here that I really wanted to read. It's not a question, but I thought you guys would appreciate to hear it. A nurse patient navigator provides a wealth of information that is specialized to the needs of the patient in their own community. As a nurse, I had a similar role for patients with complex disease processes in Michigan. Overall care and wellness improved. Amazing work, ladies. Thank you so much for all you do. So with that, Arrow, Brittany, and Bailey, I just want to thank you all so much for participating today. And thank you for what you do for this community and for sharing part of your Saturday with us. That brings us to the conclusion of the formal part of our program today. I wanted to once again thank our sponsors for helping Ovarian Cancer Canada to make the Fall Symposium a reality. Vital programming like this is also made possible by contributions from people throughout the community, and we truly thank all of our donors for their generous support and commitment to making a difference. So as you've heard before, the presentations that you've seen today have been recorded and will be ready for viewing in the coming days. And also the PowerPoint presentations from the sessions today are available to you right here in FeedLoop. So if you click on the session where you're looking for more information, you can scroll to the bottom of that, and under files will be a copy of the PowerPoint presentation. Also now at the bottom of your screens, you will see a link to an evaluation. So this is a SurveyMonkey evaluation and shouldn't take more than about 5 minutes to complete. You also will be emailed a link to this survey in your email as well. And you know what, your feedback is so important to us on days like today and can really help shape and guide us for when we're planning for future initiatives. So if you don't mind to please take a few minutes to fill out that evaluation form, we would be greatly appreciated. Now, I don't know about you, but I always leave these days so inspired. And today and this weekend was no different. So I want to sincerely thank all of you who have shared with us today your knowledge, your expertise, your experiences, and your powerful personal stories with us. I also want to remind you that we do have TLT gatherings for women with ovarian cancer. And the next one we have will be on November the 23rd, 24th, and 25th. This is a really great opportunity to connect with women from across the country, to share stories and to learn from one another in small group settings. So you can visit our website, www.ovariancanada.org, for details on that under the events session. And finally, I want to thank all of you who have taken time from your weekend to join us today for our Fall Symposium. I hope that you connected with some new people, learned from leading experts, and mostly I hope you're feeling as inspired as I am about supporting Ovarian Cancer Canada as we press for change and improved outcomes for those living with this disease, so that women with ovarian cancer and others at risk for this disease can live fuller, better, and longer lives. So again, from all of us here at Ovarian Cancer Canada, thank you for joining us and supporting this great cause. Have a great rest of your weekend.